Breakfast in Dorset.
BBC Radio Solent.
We'll start, though, at 7:07 on Portland, where we can report today that the 16 beds at Portland Community Hospital that have been threatened with closure are officially gone. The last patient who was using them was released home on Friday, and no new patients are being admitted. Effectively, the beds have been moved to Westhaven in Weymouth. But many Portlanders have been campaigning since the outset of the proposed changes to healthcare in the county to save those beds. They say they need to keep beds on Portland. We can talk to one of those campaigners, Giovanna Lewis, who joins me on the line now. Giovanna, good morning.
Good morning.
Good to have you there. So explain that to me. Why do you feel like having these beds on Portland was and is vital?
Well, Portland is a very deprived area. We're losing lots of community resources, and the hospital beds play a valuable part in rehabilitation of our elderly, and also it's the only place where we can have end-of-life care on the island.
So your reaction then to the news that no new patients are being admitted to those beds, effectively they have gone?
Yeah, well, we're very, very sad here. You know, it's continuing erosion of community services here on the island. We are very sad. I wonder how you feel about the fact that we're still waiting for the judgment on the judicial review over the proposed changes to healthcare in Dorset, and yet it feels here like one of those proposed changes has actually just gone ahead. Yeah, absolutely. We're optimistic. We're keeping our fingers crossed. We're also lobbying the Health Scrutiny Committee in Dorset, who seem to be delaying their vote for referral, but we've got our fingers crossed on that as well.
We've spoken to Dorset Healthcare about this. They said in a statement they are having difficulties in securing enough staff to safely operate beds at Portland Hospital. They add that Westhaven in Weymouth is an excellent hospital supported by a consultant specialist in elderly medicine, and that all services other than beds will remain at Portland. And they conclude by saying an engagement process will now begin with the people of Portland to consider the future of NHS services on the island. I mean, Giovanna, I guess the drive, or part of the drive for these reorganisations of healthcare right across the county has always been about focusing specialisms. So whether that is A&E moving to Bournemouth from Poole, whether that is, I guess, beds moving from Portland to Westhaven, the idea being that people are able to go where care is best, even if that means that ultimately that care is slightly further away from them.
Well, I think to say that Bournemouth is only slightly further away, is a bit misleading, really. Have you ever tried to get to Bournemouth Hospital through all the traffic in Bournemouth? We're told that it's about specialisms and building specialisms, but, quite frankly, I don't see why we can't have both good community services and specialisms, really. Don't we deserve that?
What will you now do specifically about these Portland beds? I think you've written an open letter to the Dorset South MP, Richard Drax, and to Dorset Healthcare's Chief Executive, Ron Shields.
Yeah, well, our open letter, signed by a few dozen councillors and significant people, was basically asking for further discussions on the claims that they can't get any staff, but that's actually been refused and ignored. We're still waiting to hear from Richard Drax. He did offer to meet with campaigners during the public meeting at the beginning of July, but we still haven't had anything formal from him in terms of making an appointment.
Yeah, and how do you feel about that, bearing in mind that here we are talking about the fact that these beds have now, more or less, well, they have gone.
Yeah, I mean, it's just dreadful, really. And of course, Portland beds are just part of many community beds that Dorset's going to lose. And I mean, equally, they claim that, care closer to home is what's going to replace it. But if you've read anything about the judicial review, you'll know that the consultation on that was very misleading. When people were asked if they wanted care closer to home, none of them actually realised that would mean closing beds. And equally, the staffing requirement for care closer to home relies heavily on social care staff, and the judicial review also found out that no workforce impact assessment had been done around social care staff. So we wait to see, basically. We're not giving up. We're going to keep doing what we can, and it continues.
Giovanna, it's good to talk to you this morning, as ever. Giovanna Lewis there, one of the campaigners who wants to see the beds remain at Portland Community Hospital. We expect the results of that judicial review, by the way, sometime early next month. 12 minutes past 7, you're listening to BBC Radio